I would like to present to you a paradigm shift for treatment of male survivors of sexual trauma. The reason why I call my book Beyond the Shiny Object is the majority of the time, the reason why men are coming into treatment is because they want their shiny object treated. And it's up to us as therapists to look past that shiny object and to be able to identify the function of that particular behavior. And when I talk about functional behavior is that there's always a reason why we do what we do. And my worldview is that we operate from the lens of safety as to what compels a behavior. And what we know about trauma is trauma does not understand the concept of time. And so it continues to believe that something that's happening from the past is happening to today. One of the things that I say to the men that I work with, if your response to the situation is not in proportion to the situation, it usually isn't about the here and now, but it's about the past. And so how do I use this paradigm shift to help the men that I work with to be able to heal from their sexual trauma? First thing we need to understand is that men experience sexual trauma very differently than women do. 75% of men are abused within the context of institutions. And what I mean by that is it's within schools, sports organizations, religious institutions, and clubs like the Boy Scouts, which is a very different experience than women, as women are mainly abused within the context of family and family relationships. And so therefore the grooming and power paradigm is significantly different for men than it is for women. It is that paradigm that we need to be able to focus on, because what I talk about in healing of sexual trauma or interpersonal trauma is, although injury occurs in the context of relationship, so does healing. So you'll see here on the poster that I focus on 3 shiny objects, and we'll get a little bit further into detail as the video goes along. But I talk about hypersexuality and sex addiction, as that often is one of the major presenting problems that they are coming in, whether they're spending too much money, they're not faithful to their partners, but some kind of compulsive sexual behavior is an interplay in this. And therefore we can use this particular tool to be curious as to get past that. We often have to keep in mind about how the gender construct is developed for men. And stoicism and resilience is one of the major factors in the way that they navigate what we call trauma. And those things in and of themselves inhibit their ability to be able to recover. As many of us know, men die by suicide at 4 times the rate than does women. We also know that addiction is very prevalent with men. And so looking at those particular elements can be very helpful and curious to us as to how do we navigate trauma. So from a treatment perspective, one of the first things that I do is I educate the men that I work with about PTSD and what they are. And I've broken them down into these 3 very simple categories: avoidant, anxiety, and repetition. Now, when we look at avoidance, this is going to be something that very much resonates with men, is because men avoid feeling physically within their body, feeling emotions, or leaning into things that are very difficult. Like, what's the point of that? That was something that happened in the past. The next element, which is probably something a little bit more complicated to understand, is I actually utilize the window of tolerance and people understanding the concept that we are most functional when we are in our window of tolerance, and that when we get hyper escalated, we move into the fight-flight response. And when we get hypo escalated or hypo aroused, we move into the fawn and freeze response. Now, explaining these things in greater detail often helps men understand that it's the dysregulation of their nervous system that leads into these, and it leads into other tools which they can then begin to regulate their emotions and move into that window of tolerance more effectively. Frankly, the majority of the clients that I work with are much more in the freeze response, because that fits in with the role construction of stoicism. The problem with that is they often are not even realizing what's going on because they are so disconnected with their bodies. I often also use the aspect of the fawn response, because one of the aspects that we see with men is they become very performative. And this really is true for anyone who's experienced interpersonal trauma, is they begin to identify their value associated with how they are able to perform. So they get really great grades, they become significant athletes, they try to access power through money and position. And so realizing that the reading of their perpetrator and navigating their moves before they know them is a useful tool in business. And so I'm able to kind of hook that as to the function of the behavior, that was something that allowed you to navigate a situation in the past, but sometimes that's creating a problem because our ability to be authentic and in the here and now is much more difficult. This also begins to mitigate the shame because they begin to understand that, yes, that was a tool that was useful then, but it may not be useful to me now. Often the repetition element can be one of the biggest hooks that I can use in order to help men be more curious about how trauma from the past is present to today. As we know, most trauma narratives are very secretive. Sexual trauma is very secretive, and so they need to lie and cover up about the dynamic of this particular relationship. And one of the things I hear with the men that I work with is I lie about some of the most simplest things, or that their deal of shame related to a particular behavior is so great that they lie about that as well. And so I can connect that repetition of the lying aspect from the past to what's happening in the here and now. Next, I begin to explain these 5 elements that Dennis Daly created. He is a sex educator, but it really is a great framework to be able to understand how does my sexual trauma and PTSD interact in my sexual development. And so he identifies these 5 different factors: sensuality, intimacy, sexual identity, sexual health, and sexualization. So when we look at the 3 shiny objects, we can now see the intersection between PTSD and our sexual development. And again, when I see the conversion between the two, it helps the men begin to deconstruct the function of the behavior that is existing today. So let's take the first one, hypersexuality. You can see that it's related to the repetition element of PTSD, and it also is related to the sexuality aspect. The other thing is that it also can be part of the performative aspect, or the anxiety aspect, as it relates to PTSD as well. The second element is sexual dysfunction, or erectile dysfunction, or delayed ejaculation. These are all things that prohibit us from being connected or intimate with other people. So there's a relation of the avoidance aspect of PTSD and intimacy, whether it's physical or emotional intimacy with our partners. It also is a creation of avoidance related to the body, right? If I am not connected to my body, my ability to be excited and therefore either be able to orgasm or have an erection can be impacted by that. And one of the American narratives is that we deal with things from the medical model. There must be something wrong with me physically, and so I need to take a pill or have a device in order to be able to navigate my sexual health, when in reality it often is related to this particular sexual incident. One of the things we do need to be curious about as well is that sometimes the sexual trauma can be the shiny object as well, because sometimes it's not just about what happened to us, but our response to that as well. The third item that I bring up is about hypermasculinity, and the reason why I bring that is that it's also often presented to us in treatment, and it very much is related to that stoicism, that when I'm a man's man, I don't talk about my feelings, and so I'm going to avoid that. To feel vulnerable and to be intimate is a struggle for me, but hence that's where the recovery is going to take place. And a lot of that is related to the anxiety related to being vulnerable means that I will be victimized again. So I'm going to really lean into my guns, my politics, the red pill society, so that I can be this hyper masculine individual. So there are 2 aspects that I really want people to focus on when it comes to hypermasculinity. One is that part of the sexual trauma is that men feel betrayed by their bodies because they responded in a way that they did not want to, especially if their orientation does not match the perpetrator. And so by being hypermasculine, it can send a message like, hey, I'm not gay, so don't mess with me. But the other aspect is about the vulnerability, that when I am hypermasculine, I am messaging to other people that I will not be a victim again, and I hold on to that stance because the only way that I'm going to be able to set boundaries is this external force that I have. And so it's something that helps us to be curious about the function of that particular behavior. So finally, I talk about the 15 aspects of being a fair witness. To me, this is an essential part, as since trauma occurred within the context of the relationship, I need to be the best person that I can be so that men can heal within the context of that relationship as well. Robert Heinlein in Stranger in a Strange Land refers to this concept as it reflects a deep commitment to authenticity, neutrality, and psychological vulnerability as the pursuit of truth. Anyone can achieve these 15 attributes, and this is truly where healing occurs. If you have any questions, please ask me. I hope that's helpful. Stay curious and have a great day.